So Botox is the trademark name for botulinum toxin, and it is one of my favorite procedures because it's very quick and you will see results in 3 days. So it's amazing what kind of results you can get and results that you can see very quickly. This is a perfect procedure for areas where you have wrinkles or lines that are caused by expression or movement. Lines that are caused from smiling, frowning, and those lines can be erased with this procedure. There are two types of botulinum toxin A. There is what everyone knows as Botox, but there's another brand called Dysport or Dysport. Those are the two most popular brands out there. I like to sometimes combine the two. So for Hillary, I would use the Botox on her glabella area and the Dysport or Dysport on her forehead and her crow's feet. So it's a very simple procedure. A few injections in those areas to those muscles will cause a relaxation of those muscles that have been working really hard over the years. And in 3 days, she will start to notice a difference. And in 2 weeks, she will have the full effect. So one of the things my patients are always concerned about these procedures is they don't want to look frozen or unnatural. And I totally agree. You don't want people to look at you and think, what did she do to herself? So I think it's really important to erase some of those lines, but in a way where you could still move your eyebrows, you could still smile, and you could still look like you haven't had anything done. Another great quick procedure that you could do in the office, in your doctor's dermatologist's office, is an injectable or a filler. These are great things to do, especially as you age. You start to lose the volume in your face, especially your cheeks. You lose that fat pad, and then you start to get these smile lines and what we call the marionette lines. And those can make you look older. So depending on what you need, we decide on the filler for you. In Hillary's case, she has lost some of the volume in her cheeks. So we're gonna add a filler, it's called Radius, into that cheek to add a little volume, but not to overdo it, because if you overdo it, she looks swollen or overdone, or look like a chipmunk, and we don't want that. So we're gonna put a few fillers into her cheeks, and you can see already how it looks right away. And this will last about 6 to 9 months. She also has these little upper lip lines, and it's not from smoking. A lot of people get that from sun damage. So what we want to do is put a little filler in here to cause those lines to disappear. And I like Restylane or Juvederm in those areas, as well as into the smile lines and into the marionette lines. So we're going to inject Hillary in those areas to improve those lines. The other thing you could do is put a little Botox in the upper lip line and then also the angle of your jaw to create a little lift, so those lines will also disappear. So I like to have my patients show me those muscles that are causing those lines to appear. Then I inject them immediately into those muscles that I see as they are frowning or smiling. And that gives me a place to put the Botox or the Dysport into those muscles. After the procedure, I like to ice my patients just to prevent any bruising from occurring, because that's the most common side effect. After icing, I like to put on a cream, a vitamin K cream. A vitamin K cream is a natural substance that you can use. You could buy that in a drugstore to put on bruises, and it prevents the bruises from forming.